Can urethroplasty surgery improve your sexual function? You have been silently suffering and you hesitate to talk about it, even with your partner. The pain, the burning, and the slow stream. And then comes a deeper fear. Will I ever have a normal sexual life again? Will this surgery ruin everything or could it actually make the things better? I, Dr. Gautam Banga, urologist and andrologist, and I'll meet men every day who are actually battling urethral strictures and feel like their masculinity is under threat. Today, I want to speak directly to you with facts and not fear. Let's start with the basics. So, urethroplasty is a surgical procedure which is used to repair or reconstruct the urethra, the tube that carries urine and semen out of your body. This procedure is usually recommended when there is a urethral stricture, which is narrowing of the tube due to scarring, trauma, infection, or any previous surgery. Now, here the big question which I get all the time from my patients. So, doctor, will urethroplasty affect my sexual life? Let's break that down with empathy and science. So, they question, will I lose my erection after surgery? Will ejaculation be painful or impossible? Will I lose sensation in my penis? So these fears are real and I completely understand them. After all, your sexual function isn't just physical, it's deeply emotional. But the truth is, in most cases, urethroplasty does not impair sexual function. In fact, it often improves it. Let's talk facts. According to published studies, over 85 to 90% of men who undergo urethroplasty retain full erection post-surgery. In many cases, the ability to ejaculate improves, especially if you had difficulty ejaculating due to blockage or stricture. And sensation in the penis is generally unaffected, as the nerve which are responsible for the pleasure during the sexual process lies deeper and very much away from the surgical field. But here what's even more powerful, many patients report an improvement in sexual confidence. Why? Because when your urine flow is normal again, when there is no pain, no infection, and no anxiety about performance, you feel like yourself again. Now, let's be honest, there are risks linked with this surgery, like the way it is linked with any other surgery. In rare cases, nerve irritation or scar tissue can affect sensation to some extent. Poor healing or repeated strictures can cause ongoing symptoms. And over-aggressive surgery in the wrong hand may impact the function also. But when it is performed by an experienced reconstructive urologist using the right technique tailored to your anatomy, the risks are minimal and very much manageable. That's why choosing the right surgeon is just as important as choosing the right surgery. So just a quick story about one of my patients, a 35-year-old man, married and having one child, came to me with a severe stricture and a fear that he did never feel whole again. After his urethroplasty, not only did he started urinating normally, but he came back 3 months later with tear and a smile on his face. Doctor, I didn't realize how much my anxiety was affecting my sex life. Today I feel like a man again. And he's not only the one. There are many stories like this, and that's the reason I do what I do. If you're living in pain, holding back your questions, and unsure whether your surgery, the urethroplasty surgery, will help you or hurt your sexual life, please hear this. You are not alone. You are not broken. And of course, there is always a hope. Urethroplasty, when done right, doesn't just fix your urethra. It restores your confidence, comfort, and connection. Still unsure? Let's talk in comment, or you can always book a consultation. And my helping hand is always there to hold you and take you through this journey of urethroplasty.